the bombing raids were very efficient, in addition to what was done on the ground in that World War. And yet, in 1945-46, with some help from our Marshall Plan, and in extending years after that, the people of Western Europe, through their trade unions, their multi-party system, and their cooperatives, demanded and received, for all the people, paid maternity leave, paid family sick leave, paid daycare for children when the parents were at work. They demanded and received good public transit, decent wages, decent pensions. They demanded and received paid vacations starting 4 weeks a year. They demanded and received tuition-free education. And they demanded and received full health insurance. 63 years later, we don't have any of these for all the people in this country, in the richest country in the world. They didn't deliver. The Republican Democratic Party did not deliver in the 40s, in the 50s, in the 60s, in the 70s, in the 80s, in the 90s, in this decade. It's time we became impatient. It's time we made our collective apathy boring and became more civically engaged and aware. The way a society is controlled, short of a police state, is by controlling expectation levels. There is no Western country in the world that has lower expectation levels for the quality of life and what a prosperous modern economy should produce. Back in the 1930s, John Maynard Keynes, the brilliant British economist, projected that it wouldn't be long before modern productive economies in North America and Europe would solve the economic problem, as he said, solve the economic problem, by which he meant that they would produce the basic necessities of life because of the productivity of the economy. Western Europe has essentially abolished poverty as we know it in its dire straits, affecting over 40 million people in this country because they have that kind of safety net. We have been saddled with a cruel market ideology that takes the market and burdens it with responsibilities that it could never fulfill, way beyond its proper dimension. And that ideology, pummeled by a dominant airwaves propaganda, airwaves that we own, by the way, but are controlled more and more by corporatist propaganda, into making us think that we just have to go our own way as individuals through life. And some of us make it, and some of us don't. And it's our fault if we don't. It's our fault if there are accidents. It's our fault if there's genetically based illnesses. It's our fault if we're laid off after 35 years and shown the door by companies heading for China. It's our fault. That kind of mindset has to be replaced with a sense of humane community. We have to band together in order to remove from our levels of anxiety and economic deprivation and job security and how do you pay for college and what's happening to my pension and is Social Security going to survive and are we going to have health insurance if we have a major family illness, or are we going to be denied benefits? What kind of life is that for people who work 1, 2 jobs, long commutes, time from their children? It's not like the American people are lazy. They actually put in more hours than any Western country, and including Japan, which had that rating a few years ago. We spend more hours to try to make ends meet than any industrial country in the world. And we're the only industrial country without universal health insurance. Now look at the price that we pay for that. The Institute of Medicine of the Academy of Science estimates that 18 to 20,000 Americans a year die because they can't afford health insurance. Just think of that. That's over 6 9/11s every year. A study which is about to come out is going to double that, more than double that, and you'll be reading about it in 3 days. In other words, we're coming close to 1,000 people a week who die because they cannot afford health insurance. We know full well that people who don't have health insurance have worse health outcomes by and large. But when you bring it down not just to the number of fatalities, but the hundreds of thousands of people who are sick and injured and who can't afford treatment, those are the silent ones, year after year. You wonder how much we actually care about ourselves as Americans. Once the flag waving is over, once the national anthem is sung, once the Pledge of Allegiance is articulated, how much do we really care for one another? How can we love America if we don't love Americans? And doesn't that Pledge of Allegiance say it all in the last few words? With liberty and justice for all? It seems that the debate is very antiseptic. It doesn't deal with the human tragedies. It deals with how are they going to pay bills. And of course, there's a wide range of opinion about that. In Washington, which is not supposed to be known as the seat of governmental censorship, in the last 8 months, what's called the Medicare for All approach, the single-payer approach, has been kept off the table, except for a few doctors and nurses and others who have valiantly tried to stand up in Senate committees and in rallies to put it back on the table. Senator Max Baucus of the Finance Committee, who's considering the legislation, had 15 experts testify one day about health insurance. Not one of them was a single-payer advocate. Even though the single-payer approach, the full Medicare approach, is supported by a majority of the American people, 59% of physicians, and an even higher percentage of nurses. And it's kept off the table. What is on the table is a bewildering variety of proposals that have not even been focused in any way by the White House, which has led to the split in the Democratic Party, to the Yahooism of the Republicans, and to the bewilderment of the people who don't even know what they're being asked to support. In other words, the people are not at the table. The victims are not at the table. The people who have to pay and pay and pay don't have any say or say or say. But we live in a period of American history where it's easier to get people, especially young people, indignant about ethnic, gender, and racial slurs rather than ethnic and gender and racial injustice on the ground. And the lack of indignation leads to people not informing themselves because they think they're powerless. People think, well, they're apathetic. It's sort of different sides of the same coin. And they exclude themselves from this struggle that's been going on for so many years that we ought to be ashamed of ourselves. It was Harry Truman. President Harry Truman proposed this right after World War II, universal health care. And again, then came Richard Nixon, of all people. He actually had a plan. It wasn't quite like Harry Truman's, but it was better than Bill Clinton's plan, which came another 20 or so years later. Nothing has passed except Medicare and Medicaid in the mid-60s. When Medicare passed, the amount of health care expenditure in that year, say 1965, was slightly over $3